Davin Lim, dermatologist. So you'd like to know about how we employ fractional lasers when it comes to treating melasma in some cases of pigmentation. So here's the disclaimer. When fractional lasers first came out, we're talking about 2006, 2007, it got approval by the FDA using the Fraxel 1550 wavelength to treat melasma. That study is somewhat embarrassing for the company because we all know that using Fraxel, especially 1550, to treat primary melasma, not resistant melasma, but primary melasma, does not usually work. In fact, in most cases, fractional lasers such as Fraxel, in the context of melasma, often flares up the condition. So let's fast forward to where we are today. Can fractional lasers be useful when it comes to treating melasma? The answer is yes. However, you've got to use certain types, certain wavelengths, in certain settings, in certain patient types. So in the context of melasma, using the 1927 thulium laser is the best one so far. But we've got to use very, very low settings. So in the scheme of things, we're using anywhere between 2, maximum of 5 millijoules with a density of between 10 to 20%. What that equates to is mild redness when you're actually performing the procedure with desquamation, in other words, peeling that's very mild, short-lived, for maybe a period of 2 to 3 days. The problem with fractional lasers, including CO2, thulium lasers, as well as your erbium glass lasers and all the other novel wavelengths from 1440 all the way up to 1570, is that they do produce heat. Certainly we can work around that, but still at the end of the day, in the context of what's out now, when we talk about things like Pico lasers or short pulse duration nano Q-switch lasers, the thulium or diode lasers in that wavelength still produce a lot of heat. When you produce heat when it comes to the treatment of melasma, you can flare up melasma itself. And hence, in my practice, in our practice, both in Brisbane and Sydney, we tend not to use fractional lasers. The caveat is, number one, if you have melasma that's unresponsive to conventional therapy. This is when I use the deeper wavelengths, the 1550, 1540, 1570 wavelengths to try to exfoliate the pigment which is deeper in your dermal layer. The second thing I do is that once melasma is quiescent, in other words, once we treat it, we've got some remission, but if the remission does not last long, I use fractional lasers to help repair the deeper dermal layers of skin. And in this context, the fractional lasers repair what's known as the senescent fibroblasts. In other words, the dermal architecture by stimulating some of your cells to produce more collagen and change the profile of which they secrete the cytokines and growth factors. This in turn makes the skin stronger. In other words, the basement membrane more intact, right, and more resilient to things like photo damage and the dropout of your melanocytes. And number two, it changes the profile of which this fibroblast, in other words, a collagen-producing cell, talks to your melanocyte. So it modulates that cytokine pathway. And that's very important because all these cells crosstalk when it comes to melasma itself. So guys, just to summarize, fractional lasers are awesome, absolutely awesome for treating non-melasma pigment. You've got to have the right skin type. So we're talking about skin type 1, skin type 2. It can treat darker skin types like myself. However, you'll need more treatments. In that regard, picosecond lasers are much more efficient. Number 3, fractional lasers can be considered in some cases of resistant melasma when everything else fails. Number 4, fractional lasers can be used to increase the remission periods after pigment clearance in some, but not all patients with melasma.